Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. This is quite convenient for the study. So in the last class we have seen one of the broad classification of the vitamin D deficiency, and now today we will have another classification of vitamin D deficiency, that is vitamin D dependent rickets, and another one is vitamin D non-dependent rickets, which is also called as refractory rickets. So that we will see. Now, vitamin D dependent rickets, that means this is the congenital cause of vitamin D deficiency. Patient will present with refractory rickets and will not respond to normal supplementary vitamin D treatment. So in this case, vitamin D deficiency is not the cause. Its level is normal in the blood. Okay, so the heading is quite wrong here. It should be vitamin D non-dependent rickets. Okay, that means whatever the amount of vitamin D present in the blood, suppose the vitamin D amount level in the blood is normal. Okay, you are also taking good amount of the dietary intake of vitamin D. You are also exposing yourself to the sunlight. In spite of that, the child is developing rickets, and this is called as resistant vitamin D resistant rickets, or it is also called as refractory rickets. Now, if the problem is with the diet, if the problem is there with the exposure to sunlight, if the problem is there with the formation of the storage form of the vitamin D in the liver, so then usually we will call it as nutritional rickets. It is called as nutritional rickets or vitamin D dependent rickets. That means it depends, rather vitamin D non-dependent rickets. Again, this particular the heading is right. Sorry, okay, I'm a little confused. Heading is right. That means here first we have got two things. One is nutritional rickets and non-nutritional rickets. Okay, nutritional ricket is the one if you provide good amount, there is problem in the deficiency of the vitamin D, and if you provide good amount of the dietary vitamin D or by supplementation of the vitamin D, the things will be okay. Okay, it's the problem either with the dietary intake or maybe some poor absorption and all. But vitamin D dependent rickets means, okay, dependent means whatever the amount of diet supplementation you give, so that will be only converted into the storage form and it is not converted into the active form. Okay, we know that the active form vitamin D1, so that is very important for ultimately for the absorption of the calcium. Now, although there is lot of amount of vitamin D is there in the body, but its conversion from the storage form to the active form is get affected. Its conversion from the storage form to the active form is get affected. So here the only way out is left to us. You have to give the ready-made vitamin D3 active form of the vitamin. You have to give the active form of the vitamin D1. Okay, because there is some problem in conversion of storage into the active form in the body naturally. So from the outside you have to supplement this vitamin D1 active form so that the function will be carried out. Okay, therefore we will call it as vitamin D dependent. Now it is dependent on your outside or external supplementation. Okay, I hope you understood this point. So this vitamin D dependent rickets means this is the congenital cause of vitamin D deficiency. Patient will be present with refractory rickets and will not respond for normal supplementary vitamin D treatment. Okay, now the things are clear. I made a mistake in the beginning by giving some wrong concept. Okay, now in this case vitamin D deficiency is not the cause. Dietary vitamin D deficiency is not the cause. There is sufficient amount of vitamin D is there in the body, but problem is that sufficient amount of the vitamin D which is present in the storage form of the vitamin D is not converted into the active form. For the conversion into active form, there is a requirement of one enzyme called as alpha 1 hydroxylase 1 alpha hydroxylase. So that is absent. Therefore there is no formation of the vitamin D1 in the active form. So now externally you have to give the vitamin D1 in the active form of the vitamin D1. Okay, just like insulin. Now this particular vitamin D dependent rickets or refractory rickets is of again two types. One is VDDR type 1 Another one is VDDR type 2. VDDR means vitamin D dependent rickets type 1, vitamin D dependent rickets type 2. Now talking about VDDR type 1. VDDR type 1 is basically an autosomal recessive problem, more commonly seen in less than 2 years of age. Okay. So what is the problem here? The problem is there is mutation in the gene which codes for 1-alpha hydroxylase enzyme. We know that the role of 1-alpha hydroxylase enzyme is very, very important. It is the one which converts the storage form of the vitamin D into the active form. Now in this VDDR type 1, what actually happens is this 1-alpha hydroxylase enzyme is not formed properly because of the genetic problem, mutation. It is an autosomal recessive type. So as a result, there is a decrease in 1,2,5-dihydroxy vitamin D3 and the normal 2,5-hydroxy vitamin D3. So ultimately, what is the problem? There is no formation of the active form of the vitamin D. So when there is no active form of the vitamin D, calcium is not absorbed. There is no calcium deposition in the bone. If the calcium is not absorbed, it also affects the phosphorus, and phosphorus is also not get absorbed. So there will be rickets similar to the nutritional rickets. It looks like a nutritional rickets only, but the cause is different. If you provide whatever the amount of vitamin D, D, so it will not be corrected. The problem is not with the storage form, the problem is always with the active form, because that particular enzyme, 1-alpha hydroxylase enzyme, so that is hereditarily absent or it is not functioning. So this is VDDR type 1. Now another is VDDR vitamin D resistant type of rickets type 2. Now here there is increase in the 1,2,5-OH, that means active form is formed actually here. Here D1 active form is formed. This condition is more than very common in less than 1 year of age, very young age, that means 1 year of age, infantile period. What is the problem here? There will be mutation in the vitamin D receptors which are present in the end organs and are resistant for 1,2,5 vitamin D. Here the problem is different. Here there is no problem with 1-alpha hydroxylase enzyme which is converting this vitamin D2 to D1, that is storage form, into active form. Active form is present in enough quantity in the blood. Now for the absorption of the calcium, so for the absorption of the calcium, this active form of the vitamin D should go to the intestine, isn't it? And it has to bind with the cells receptors which are present in the cells of the intestine. Now in VDDR type 2, what happens? There will be some problem in the there will be mutation in the vitamin D receptors. That means in the intestinal cell walls there will be some receptors which are very specific for active form of the vitamin D or D1. Now that receptors are itself is not formed, or they are functioning in an abnormal way. That means they are not responsive to the vitamin D active form. So although enough amount of the vitamin D is there in the blood, so that is not able to go and bind with these receptors which are present in the intestinal cells, and unless and until it will bind, the absorption of the calcium is not possible, and this is what actually happens, and as a result calcium absorption not takes place, and once the calcium absorption not take place, phosphorus is also not get absorbed. This is how it leads to rickets. So I will repeat again, the mutation is in the vitamin D receptors which are present in the end organs, that is the intestine, and these receptors are resistant for 1,2,5 vitamin D or active form of the vitamin D. So in this case there will be normal production of vitamin D active form 1,2,5 vitamin D, but the peripheral intestinal and other cells from where actually the calcium absorption takes place, for the absorption of the calcium, vitamin should be go there and it should be bind with these particular receptors. So peripheral intestinal and other cells are insensitive to it due to the receptor problem. So again the calcium absorption is get affected, and symptoms are similar to the nutritional rickets. This is associated with the alopecia. One thing, usually this type is also associated with the alopecia and ectodermal defects in 70% of the cases. So this is VDDR type 2. Here there is no problem with your dietic vitamin D, whatever amount, that is okay. Okay, in the first case VDDR type 1, dietary is normal, storage form of the vitamin D is normal, but the active form is not formed at all by the due to the absence of 1 alpha hydroxylase enzyme. But in the VDDR type 2, even active form of the vitamin D is also formed normally, but that active form is not able to bind with the receptors which are present in the end organs like intestine, etc., and as a result the absorption of the calcium will not take place. So this is VDDR type 2. So these three are basically three different conditions, but it looks like a nutritional rickets. The presentation of the patient is a rickets, that bow legs and all those things will be there, but cause is different. So merely giving vitamin D drop is or merely supplementation of the vitamin D in the diet is not sufficient. Sometimes the problem will be different. Okay, so these are the two important types. The next one is talking about calcium deficiency. There are so many causes for the calcium deficiency which may also lead to rickets. That means your vitamin D1, D2, D3, everything is normal, enzymes are normal, but still there is some calcium deficiency itself is there, which leads to problem, or calcium absorption problems will be there, so which may lead to rickets. So that we will discuss in the next class. Thank you very much.